Hello, my name is Rizwan Alvi. I'm a consultant plastic surgeon and I'm also the managing director of Sthetix Clinic in Liverpool. Today we're going to talk about botulinum toxin, commonly known as Botox, one of the most common treatments carried out around the world. This treatment is for reducing facial wrinkles. Now, facial wrinkles are of two types. Commonly known as dynamic, or those related to movement of the muscles of the face, and static, which are really permanent lines on the skin of the face, which are not related particularly to the muscle movements. Botulinum toxin works by reducing the movement of the muscles, and depending on the dosage of the toxin injected into the muscle, it can either cause slight decrease in the movement of the muscle, or in the other end of the spectrum, completely paralyze the muscles. And this allows us to control and reduce the dynamic movements. Botulinum toxin treatment is carried out using very fine needles to inject a carefully measured amount of the toxin into specific areas of the face. This allows us to control which muscles we're going to target and soften the effect of these muscles on the production of wrinkles on the face. So, for instance, there is the muscle which lifts the forehead, and that causes the horizontal creases on the forehead. And this muscle can be treated with botulinum toxin to reduce the appearance of these wrinkles. The treatment is not very painful and is usually very well tolerated. Once the treatment is done, the effect of the toxin takes about 3 to 4 days before taking full effect. And this means that the patient starts to feel the treated area to be heavy and there is reduced movement in the area. Well, I'm often asked the question, how long does it last? Well, it depends on the patient. It normally lasts about 3 months, but in some individuals it can last longer, especially those who've had treatments on a regular basis. The effectiveness of the Botox can start to last longer, and the repeat treatments can be at 4 months. Like any treatment, and this requires injections, there are risks. The risks include a little bit of bleeding, which can sometimes lead to a bruise. That bruise can be quite variable, but generally speaking, these are small bruises which settle down in a few days' time. There are other things which can occur as a result of the treatment of muscles. Because muscles are weakened and we have muscles on both sides of our face, you can occasionally see either asymmetric results, whereas one brow rises more than the other, or the over effect of the treatment could lead to drooping of the brows or drooping of the upper eyelids. Another more serious side effect can be when Botox gets into the muscles which move the eyes itself, and that could sometimes result in diplopia or double vision, which can last about 3 to 4 weeks. It is a self-limiting, which means it just gradually settles down itself, but during the time this happens, it can be quite distressing for the patient. Very, very rarely there have been some reports of a flu-like symptom in some patients which can last a few weeks after a Botox injection.